So we're going to practice how to order PFTs on your patients. You will go to Orders and click Add. Type in PFTs and then select one of the two options that says Pulmonary Clinic. Either option is fine. You will see this first screen, which is general information for your patient. Select the diagnosis. You can click on more than one. Under Indications, History, and Clinical Findings, if this is the first time your patient is doing PFTs, select Other and type in a brief clinical history. If this is follow-up PFTs for your patient, select Interval Change. If you have no infectious concerns for your patient, select No Concerns. If you have any infectious concerns, select Concerns and briefly explain in this box to the right. Under To Be Scheduled By, if you're ordering these PFTs from the pulmonary clinic, select Referring Clinic. If you're ordering PFTs in a patient that's admitted to the hospital, select Inpatient Unit. Any other specific testing requirements that you need the PFT technicians to know for this patient, you can type in here in this white box. When you're done in this screen, select Test Requested. Here, as you can see, the pulmonary lab offers many tests that can be done in our patients. Here you will select the ones you want to be done. Under spirometry testing, you have to be specific and specify which type of spirometry testing you want. Is it just pre-bronchodilator or post-bronchodilator only? You can choose more than one in this area. If you want inspiratory loops to be done, select it here. We typically do PFTs in the sitting position, but if you desire for them to be done in the sitting and supine position, you can select it here as well. If you want long volumes to be done, select it here. We typically do long volumes with plethysmography. If you want diffusion capacity to be tested, select it here. This is the DLCO. For maximal inspiratory and maximal expiratory pressures, you're going to select it here. There's other things you can order too. We typically do 3-minute walk tests in some patients, which is a shorter version of the formal 6-minute walk test. And for that, you will select Exercise Saturation Study. If you want an oxygen saturation to be measured in your patient, select it here. We have to clear all patients to receive bronchodilators in case needed. If your patient is okay receiving bronchodilators and there's no contraindication, select Clear. And then specify which bronchodilator can the patient receive. Most of our patients can receive albuterol. If there's any contraindications to albuterol, Sopanex and Atrovent are other options. After you're done doing your selection here, you're gonna click this green arrow, click Done, and here is a summary of the PFT order. You can change any of the information in this area of the screen. You don't have to, but if needed, you can change. For example, diagnosis. If you want to add something, you can add it here. Once you're done editing this area, you're going to assign your order. And this completes the process of ordering PFTs.